I'm Dr. Rick Greene, and it's a pleasure to be with you today for our continued legacy program, where we interview our wonderful emeritus faculty from the University of Virginia School of Medicine. I'm a graduate of the 1970 class, and it gives me especially a wonderful feeling to interview today's guest, because I was a student when he took over as chair of urology, Dr. Jay Gillenwater. Jay, thank you for being with us.
Glad to be here.
It's a pleasure.
Honored.
Well, thank you. You know, one of the things I always like to ask, you're from Tennessee.
That's correct.
You went to UT. You did medical school in Memphis.
You've done your homework.
I've tried to. But I want to know, what brought you to Charlottesville? How did you get here?
Well, that's interesting. I went to University of Pennsylvania after med school and started off in internal medicine. Did 3 years, and they had the Berry plan back then.
I was a Berry.
Everybody had to go in a service. And so when I told them that I was going to change to urology, because at our hospital there was a big internist named Bacchus. He was the GI man. He'd written 3 textbooks. But most of the patients, they either had nothing, and I guess that was 80%. They had a lot of complaints. But when you did all the x-rays and everything, you couldn't find much wrong with them. And so they were hard to cure. And then when you found something wrong, a lot of it was cancer, and we didn't do very well curing it. So I decided, well, I needed to do something different and go into urology. And then when I told the Army that, they said, no, you're coming in the Army. And then I had a patient that I was the resident, that he was I think he was the governor of Pennsylvania, and he used to eat, he wouldn't eat the hospital food, he had food brought in, and I was his companion to eat meals with steak most of the time. And I told him that what was going on, and he said, well, have you talked to anybody? And I said, what do you mean? He said, no. Oh, go down and see blah, 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 and blah, 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 and tell them I sent you. So I went down, and it was Secretary of the Army and the head of maybe Walter Reed.
Sure.
And I learned then you start from the top down. Don't work your way up. So they said, well, what do you want to do? And I said, well, I think I'd like to do some research. And they looked at me very funny and said, oh, I really meant, where do you want to go into our service? And I said, well, I still like wherever I can do some research. So when I got signed to Fort Knox, and Fort Knox is a big military base back then. I guess it still is. And it was during the Second World War. Most of the people in tanks had a very high mortality rate, and they didn't have any idea why. So they built heat and cold room there, put soldiers in the tanks in the heat and cold room, and they figured out it was from sweating, it was salt and water loss, and they were dying of dehydration. And the guy that did all that finally figured out there must be some kind of hormone, and he went to Minnesota, I guess it's Michigan after that, and discovered a hormone called aldosterone. That's your adrenal gland puts out and saves salt. So I got into this lab and spent first 2 months in the heat room. They were still putting people in tanks and measuring all sorts of stuff. And then I set up a research lab and studied what happens if you block kidneys. And,
well, it just shows you what serendipity does for people. You were in internal medicine. All of a sudden you turned out and you really found yourself in urology, which has really led to so many things. I'm fascinated by one concept I got into laparoscopy early in my training, not in my training, but after I was trained. And of course, one of the ideas was you could use a lithotripter to break up gallstones.
Yeah.
Well, you were...
I broke the first gallstone up.
Right. Well, you were really involved in the beginning, recognizing that a lithotripter could not only take care of kidney stones,
Yep.
but also other things.
Yeah.
How did you get involved in that?
Well, I got involved in the lithotripter because I was the editor of our journal, and I kind of read everything, and I saw a little lab study that they were using lithotripter in rats. And so I wrote the company that if you start trials in the United States, I want to be involved. And we were one of the first ones to get the lithotripter. And then I was treating a lady that had kidney stones, and she also had a gallstone.
Mm.
And as we were finishing it, I could see something over there, and I said, let's look at that gallstone. So we moved the patient around a little bit, and there was the gallstone. I said, wonder what this will do to a gallstone. Everybody looked at me.
Did you have informed consent?
No. For two things I did. I was the first one to treat stones that left the kidney into the ureter.
Right.
And we didn't have consent on that. And I got up at a national meeting and said, well, it works and you could see them, you know. And then so I moved this thing over to the liver and got in focus real nice. And I said, well, we don't have permission and it's never been done. So let's stop at 500 treatments and see, you know, just see what it does. Oh, 200 or 300, the thing just completely broke up and everything. And so we were the first ones that did this. I don't know if you get away with doing stuff like that these days.
Well, it just shows you, right. It might not be politically correct to do that, but it shows you early on in some of the technologies, especially because you decided to work with companies.
Yeah.
That was very important.
Right.
And for a physician to do that. And I think that was a groundbreaking thing in itself.
Right. Well, it was interesting. I got to talking about it. I went to Germany to see them doing it,
Right.
and be sure it worked. Because about the time, it didn't take them long to go from a rat to a human. I mean, it wasn't getting them in trouble, so they did. And so I went over there and looked at it again, told the company, well, we'd like one. Then I came back and told some of my friends. Derrick was one of them. And,
Derrick Vaughn, sure.
Yeah, and they went over to Germany, and somebody in the group, I don't know, but in their group said, you know, this thing really works. The way we can make money is if we kind of wholesale it. You know, we be the thing in the United States, we'll tack on a price for each of the machines. And and then they told the company that, they didn't really need me. These 5 people would be the best, you know. Of course, they knew I wouldn't put up with that. So the company sent the guy back and said, here's what's happening. And they sent the president of the company over here, and he said, we're going to leave you out. You don't have the forethought to to sell this right in the United States. And I got to thinking, and I found out who that guy's boss was, and I called him and I said, you don't need a middleman. You have all the other stuff they're selling to doctors in here, they do it straight from the company. And you'll save millions. And he sent over, and I think they fired the president over here, who'd been the one that was kind of doing that kind of stuff.
And you brought it into the university, and you brought it into the world of urology. Well, speaking of technology, what's your feeling about using a robot to do a radical prostatectomy?
I don't have any experience.
Would you use it if you were still clinically active?
I would try it. I was
figured
game
you
for
would.
trying
I
stuff.
figured you would.
Yeah.
Let me just ask, because you've transitioned and you've redone yourself into a whole new area of gardening, and I've done a lot of reading about what you've been doing, and you have a wonderful documentary actually that was made about your gardening.
Yeah.
How'd you get into that?
Well, I've always liked plants, and we moved out in 1977. I was driving down 29 and saw this little road taken off back towards town, but not 29. It was Route 708. It's called Dry Bridge Road now, because the bridge goes over a railroad track. And we saw some property that had just spectacular view of the Blue Ridge. So I found out the guy that owned it and bought 3 acres. Eventually we got 54 acres. And set up, and then I had a patient that was getting out of gardening. He was retired. And he essentially gave me a greenhouse. So I put up a greenhouse, hired Lester. I advertised in the paper and got this fellow that's 2 years out of high school. And together we learned about, and we made a few mistakes, about how to grow things in a greenhouse. And now we have 6 greenhouses. We sell out every year and have never spent a dime on advertising. It's just all been neighbors or, mouth or relatives or stuff. And
you're a master gardener.
I was master gardener, yeah.
Absolutely.
And a tree hugger.
So in other words, it could have been a winery, but for your patient giving you a greenhouse, it turned into a garden.
That's true. You're right about the winery.
It's been an absolute pleasure to be talking with Dr. Jay Gillenwater today, the Emeritus Professor of Urology, past Chair of Urology, Master Gardener, and just a wonderful gentleman. Jay, thanks for being here.
Oh, my pleasure.
Thank you.